More than 5 million Americans are living with Alzheimer's disease, including 91,000 here in Minnesota. And these numbers will soar as the population ages and more people are diagnosed early. Today, an estimated 58% of older adults with dementia live at home. And of those who live in the community, 25% live alone. And while they may receive support and resources from the Alzheimer's Association, they face living in a community that lacks dementia awareness and is unprepared to support them.
There's a quote that says, "Do not cast me out in my old age." As our loved ones are aging, we have an obligation to care for and to treat people with dignity and respect and to help them to be integrated and to be part of our community.
Minnesota is leading the way one community at a time through our work on making communities dementia-friendly.
I believe that a dementia-friendly community is a community where people have an understanding of the warning signs that people might exhibit when they have dementia.
Well, to me, a dementia-friendly community is one that really supports the person living with the disease and then really the family or any of the active care partners.
A dementia-friendly community is informed, safe, and respectful of individuals with dementia.
It's a form of dementia that touches every community.
They are prepared to support them effectively and be a part of the large-scale social change that can transform the face of Alzheimer's and help people live their best with dementia.
We want to make sure that our community learns as much as we've been learning so that we can have a greater impact in our community.
You know, I think some people are frightened by individuals with dementia. They don't understand what's going on. Why does this person seem so confused? I think if we can educate the general community, the store owners, the people who are out there, the service industry, tell them what it is, what's causing it, why not to be frightened by it.
Whether it's a religious community, a geographical community, it's helpful for everyone.
And we want to inspire those people to be able to have conversations and to care for their neighbors, their family members, and their friends. And if we can't get the community talking about Alzheimer's disease or dementia, or identifying that they are a caregiver for somebody living with a disease, it's impossible for somebody to move forward and get the support that they need.
She still has emotions. She still feels love and pain. So the most important thing is we have to get educated as a community.
Through our partnership with Act on Alzheimer's, a volunteer-driven statewide collaboration transforming Minnesota's readiness and response to Alzheimer's disease and other dementias, we've set out to make each of our communities dementia-friendly, providing the essential resources, expertise, and project assistance communities need to better understand and better support their neighbors with dementia.
Act on Alzheimer's has a toolkit to help communities get ready and to begin the process of becoming dementia-friendly. And it's a 4-part phase: convening your community, surveying your community, analyzing your community, and then acting together to create and implement some kind of an action plan.
Understanding at the professional level, where firemen and police officers and medical professionals touch the lives of our elders with dementia.
Spiritual support, which really falls under the meaningful engagement goal, and looking for ways for people who have the disease, who are not living in a formal care setting, to be engaged.
I mean, that's ultimately our goal, is that everyone in the community will know how to identify dementia symptoms and know how to respond.
We've gotten a group of people who don't usually work together on a committee to address these things, and everybody has brought their own skills and abilities and talents.
We could see the need, the huge need, to provide support in this specific area to the Latino community.
And you'll hear many stories from communities about the great things they're doing, whether it's outreach to youth about educating them about the disease, perhaps it's law enforcement education.
And in St. Louis Park, we trained all of the police officers. And the day after the training, one of the police officers called and said, "Who knew how important this training would be to me?" She was called out to a nursing home, and the staff at the nursing home was having some struggles of trying to get residents to calm down. And she said she walked in and she knew exactly what to do. She got down on her knee so she was at eye level. She called the person by name, took her hand, and gently tried to coax her into coming with her so that she could remove her from an explosive situation. And she said that she just could not have ever done that had she not gone through the Dementia Friends training.
Currently, more than 43 communities in Minnesota, towns and cities, ethnic communities, faith-based groups have made the commitment to become dementia-friendly, and in the process, our state has sparked a nationwide movement, Dementia-Friendly America, that will replicate the effort in communities across the country.
The whole Dementia-Friendly America initiative really began here in Minnesota, and building on the incredible successes that have happened in Minnesota, leaders nationally took interest in this and said, we need to take this nationwide.
I've been really proud of the work that we've been doing in Minnesota, and it really is a movement that's taking on across the country.
It's had a huge impact.
And it just continues to grow.
And I'd like to just keep pushing to see those ripples go out further, because it's not going to go away. It's going to get bigger and bigger and bigger.
This is a huge opportunity to train the future healthcare providers so that they come out of school prepared to address some of those needs.
It's really been a privilege to be able to work with the Alzheimer's Association, to be able to have the support to help us move forward with this work.
And as we raise awareness through our ACT initiatives, the Alzheimer's Association is always there.
They're really empowering us to do it by ourselves as much as possible. That's the way it needs to be done.
Our vision is a world without Alzheimer's. Until we get there, we will continue to enhance the care and support for those living with the disease and expand our reach by enabling communities to provide their own unique support. And with your help, Minnesota can stay on the forefront of this transformative work to ensure that everyone impacted by Alzheimer's and other dementias is part of a caring community ready to support them.